If you want to maintain health and vitality, especially during menopause, you may be considering hormone replacement therapy, or HRT, as a quick fix for hormonal imbalances. It's tempting when age related issues begin to compound. In a rush to suppress symptoms, the complexities and risks involved with HRT tend to be overlooked or minimized. Studies have shown potential links to increased risks of heart disease, breast cancer, and strokes, especially with long term use. And HRT is never prescribed as a short term solution, it's a life sentence. Why do some women cruise through menopause while others struggle? In this video, I'll share what I think we've been missing. And if you're new here, I'm Dr. Gayla Gorman, a licensed acupuncturist, naturopath, and author of What's Your Kryptonite? On this channel, I'm here to help you reverse the effects of chronic stress so that you can cruise through menopause symptom-free without turning to medication. So let's start by talking about hormone replacement therapy and what it actually is. Hormone replacement therapy attempts to restore hormone levels, particularly estrogen and progesterone, to the levels that a normal mature woman who is not quite menopausal yet would be experiencing. The problem, though, is that there's no way that we can restore levels in the exact formula that our body would make them naturally. So it tends to create a hormonal imbalance that's just different. You're still having imbalanced hormones, they're just imbalanced in a different way. And just keep in mind that it's also not uncommon to attempt to restore testosterone levels. That happens even with men now in our hormone laced diet, with all of the unnatural substances that we consume. It's really common that we have disrupted our body's natural hormone regulation process. So the hormones naturally regulate our sleep cycle, our stress response cycle, not to mention fertility. And so it's very common that when these hormones begin to fluctuate so dramatically, sleep is the first thing that gets disturbed. And we don't go very long without desperately needing a good night of sleep. So that's one of the really common things that drives women to seriously consider hormone replacement therapy. But actually, the problem is not the hormone dysregulation. The problem is actually the adrenal fatigue that you've been somehow managing to this point. It's going to be in your best interest to give it a little extra thought before you just turn to HRT to alleviate your symptoms of menopause. You want to make sure you're reducing the health risks regardless of what you decide to do to deal with your menopause symptoms. There have been studies that have correlated the risk of blood clots, stroke, and breast cancer with hormone replacement therapy, particularly estrogen therapy. And that is really regardless of using natural bioidentical hormones or synthetic hormones. Certainly, if this is a decision you've made, bioidentical hormones is going to be a better option, but just know that the risks are there even if you are using bioidentical hormones. There is a fairly low risk of gallbladder disease, but for those of us women who tend to accumulate fat and may have accumulated even more fat during this period of our lives, we need our gallbladder functioning on all cylinders. So we definitely don't want to be doing anything that is causing more stress to our gallbladder. Another serious concern, especially for women, is the risk of Alzheimer's or some sort of dementia. And early studies have shown that there is a correlation for Alzheimer's and dementia with long-term use. There are some other less concerning considerations that tend to be short term, and those include side effects like nausea, headaches, bloating, even breast tenderness. I actually tried hormone replacement therapy myself for the first couple of years that I started transitioning into menopause. And I remember it just feeling so odd that I was actually experiencing symptoms that I hadn't experienced since I was much younger, and they were not necessarily welcome. So just know that some of those symptoms you may have experienced around just your normal cycle when you were younger may return, because the hormone replacement is mimicking the hormone levels of a much younger person. So just know that when it feels odd, it is odd. It's odd to your body as well. There's also an increased risk of blood clots or even a heart attack in the first year of taking HRT as your body becomes accustomed to it. And so, if you're not intending to use it long term and there's extra risks associated with it in the first year, then better to just avoid it altogether. For me, I have a serious risk of cancer. My grandmother, my mother, and my sister all had breast cancer. I lost my mom and my sister to breast cancer and the complications that follow. And so just know that I don't share this information with you lightly. And I do realize that we all want to slow the hands of time and avoid those signs and symptoms of aging. But I tell you what, I would much rather age gracefully, feeling generally well with overall health and well being, than to turn to HRT and potentially invite some more serious health concerns. No one wants to be sitting in the chair across from the doctor getting a diagnosis of some critical, crazy disease, is the way I refer to it. The cost of HRT should be taken into consideration as well, because insurance is not likely to cover it. So just know that whatever medical professional you use for your HRT prescriptions are going to have to be visited regularly. You're going to have regular blood tests, possibly even a more expensive out-of-pocket saliva tests, and just generally it is a management issue. I believe your time would be better spent with some things that actually move the needle for your overall health and well-being long term. So, weighing the options and sorting through conflicting opinions can add stress to an already stressful phase in your life. I understand this. This is just one example of the countless ways stress creates symptoms and other health issues, especially during menopause. I created a video that shows you how to eliminate menopause symptoms naturally, so I'll make sure to link to it below this video. But make sure you hit subscribe too, because I share a lot of tips when it comes to dealing with stress that's become toxic. Relieving the nasty symptoms stress creates makes navigating through menopause a breeze. So I mentioned earlier that I tried HRT myself for a couple of years, and I tried it in all forms. Cream, pellets, injections. Just know that when I share this information with you, it's not because I have not tried using it myself, and also have not tried multiple doctors with multiple approaches, and I gave it a comprehensive go. And I remember sitting on the sofa at home and feeling that like kind of hormone rush in my body that was not common for my mature female body. And thinking, oh, that's kind of interesting, and just wondering what else it was doing internally that was adding additional stress to an already stressed system. I found that adrenal fatigue was my real problem, And no amount of hormone replacement therapy is going to heal your adrenals. So, if adrenal fatigue is what's actually making your menopause symptoms worse, then let's get busy working on adrenal fatigue as opposed to turning to hormone replacement therapy. Some of the ways that we do that are going to require that you modify your lifestyle. You're going to want to add gentle exercise and use some stress reduction techniques that are going to really go a long way. But just know that these things are not a quick fix. They're not pop a pill, use an injection. You're going to have to incorporate these things into your daily activities. It's also going to help to up level your diet. You want to use really high quality, nutrient dense food because you're probably going to need to eat a little less in this phase of your life, maybe lean into intermittent fasting more heavily. So that means that the meals that you do eat need to be even more nutrient dense. One of the things you may not have turned to previously are foods that include a lot of phytoestrogens like tofu and soy based products. So that can be really helpful to increase your soy content. And, I love edamame at a high quality Japanese restaurant. So that's something you might try if you haven't tried it before. You can also turn to some herbal remedies, and those can be really helpful depending on what your particular issues are. Just know that herbs are medicine too, and you will need to be careful with the contraindications. Remedies like black cohosh help to deal with chronic stress and can be helpful if you're dealing with adrenal fatigue and can really help to offset some of the effects of stress. Give your adrenals a break so that they can start to heal and reverse the damage that's been caused. If your efforts to live a healthy lifestyle and do all the things you've been led to think are supposed to work aren't getting the job done, you may even be feeling like you take 2 steps forward and 3 back. In my next video, I'll show you how to manage the toxic stress that's sabotaging your efforts. You can eliminate menopause symptoms naturally without medication, crazy diets, intense exercise, or any other unsustainable lifestyle hack.